Now, Dr Hilary's back to answer your questions after Boris Johnson's announcement yesterday. Easing up the lockdown in England, other parts of the country.
Yep.
We'll find out over the next couple of days, I'm sure, what they're going to be doing. We've got loads, Hilary. I'll get right on.
I wish we had an hour.
I know, so do I. So do I. Jill says, I'm confused as to why gyms can't reopen with measures in place. Frustrated as exercise benefits my mental health.
Of course. And there are gyms and gyms. I feel really sorry for reputable gym owners. But, you know, I've seen gyms with spin bikes, 30, in a non-ventilated basement room.
Right.
With people blowing out explosively because they're aerobically exercising droplets of air into an enclosed space. Hugely dangerous. I wouldn't touch that sort of gym with a barge pole. However, there are good, better gyms with ventilation. But look, you go into a gym, guys use barbells, they're doing a chest press, they're breathing hard explosively onto the barbell, they're changing the weights. How do we know how easy it is to clean every single weight that goes onto that barbell and the whole barbell, and every virus has got to be eradicated? It's really hard in gyms, and it's because the respiratory volume and rate of the people exercising in it which makes a gym more dangerous than some other places. Yeah. And that's harsh on the really good gyms, but it's fair for the other gyms.
So things like, you know, I really miss my exercise class, obviously. I miss all the gang, I miss Maxine.
Of course.
But we can't, you know, she's doing it online, and a lot of people are doing exercises online. I know it's not quite the same, but it's actually better than maybe doing absolutely nothing.
Absolutely. It's the
at all.
enclosed space and the lack of ventilation and lots of people that's the danger.
And it's just that thing, if you just want to see people, don't you?
Yep.
Sam says, how is it that hairdressers, but not nail salons or beauty salons, they're not allowed to open right now?
Yeah, because it's basically based on the idea of being face-to-face. So in a hairdresser can wear a mask, can wear a visor, and is at the side of the person, the client, and at the back of the person, as well as briefly at the front. So it's lower risk compared to somebody who's in a beauty salon, perhaps doing nails. Can only do that face to face very closely. If they're waxing,
have a visor, I suppose, but yeah.
Yes, potentially. But if you're doing a waxing, someone's got to take their clothes off, presumably. Waxing is quite intimate. These are more intimate.
Very intimate.
Yeah, I thought you'd say that. I've never experienced it myself. But I think it's based on what is the risk level, what's estimated to be the risk level, and that's why they've put these guidelines in place.
Lots and lots of people, including Claire, saying, what does it mean for family get-togethers at, say, a restaurant? She's booked a table for 27.
Oh, OK.
From many different households. Yep. Will this be allowed?
No, it won't, because it's too many households. So 2 households.
But then, if you're in the restaurant with lots of different people, they're from different households, aren't
they? Yes, they are, but they'll be spaced away. The tables will be apart.
Right. But if they did, say they took over the whole restaurant with 27 of them, all in wee different tables.
What the guidelines are,
difficult.
I know it is. So 2 households are now going to be allowed to meet up come the 4th of July. 2 households, however many people in each household, can meet up indoors. It can be a public place, it can be a private place, it could be a restaurant, it can be a pub. 2 households can meet up, indoors or outdoors, but only 2 households, no matter how many are in that household. But you've still got to socially distance.
OK.
It's a compromise. It's allowing people to get together with their friends and their loved ones. It's a step closer to easing full lockdown, but it's still limited. So it can't be more than 2 households.
Right.
So yes, in a pub or in a restaurant, there might be other people there, but they will be well away from you.
OK.
That's the rule. It's got to be in bars. You've got to be seated. In pubs, you've got to be seated. You can't be standing at the bar and having a drink for a long time. So it's like a compromise.
No,
there's
I understand.
No perfect solution.
There isn't.
But it's better than nothing.
I just feel that maybe, just maybe, we are coming out of this really, really quickly. I mean, you've said that there will be a break, that we can apply a break. But we just have to be really careful. I just feel as if everybody's gone, yay, 4th of July, we cannot, you know, especially down here anyway in England.
Yeah,
it's like, oh, we can do whatever we like,
exactly.
And you can't.
No, you can't. The future health of the UK will depend on what people do.
Right now.
Not the guidelines, not the test and tracing, that helps, but it's not what's most important is what people do. And the guidelines are good. They're there for a reason, and most people have abided by them. But as soon as we start flouting them, we will get more outbreaks, we will get second peaks, we'll get more deaths. So it really is important that people abide by this. We know that about 1,700 one person in 1,700 are carrying the virus right now. Now, you don't know as a hairdresser which one that walks into your salon
so
has got that, which person comes into your restaurant or your pub has got that. So we take precautions, we minimise that risk of that person transmitting it to somebody else.
This is a good one. Teddy says, and a lot of people have asked this too, Teddy, when will GPs be seeing patients face-to-face for appointments? From Chris Whitty's comments yesterday, I got the impression that phone call triaging would continue, even, you know, like until the rest of this year or maybe beyond. When do you think that's going to... Because I know a lot of people really want to see their GP.
Of course they do. I understand that. And GPs will continue to do phone triage and video conferencing, video calls, because that's safe. That's dead safe. But, of course, some people need to be seen. They have to be seen. They've got a condition which needs to be reviewed. They need their chest listened to. They need their eyes looked at the back of. They need the skin examined. Examination will take place, and GPs are already supplied with PPE in order to see those people who are deemed necessary to be seen face to face, eye to eye, in the surgery.
Right. So really, it's all down to how bad your condition is, or the condition that you suffer from. Absolutely.
Yes.
So thank you so much, everybody, for all of your questions. So many. We'll have to do it again. We'll have to do it again.
But please, you know, the guidelines are there for a reason. If we all abide by them, we'll be safer.
Exactly.